Hello, everybody. Welcome to another episode of the Pillow Team Podcast. As always, I'm your host, Ray Hennessy, and we're joined with Trex Jones. Trex Jones, did you know that vaccines cause autism?
I've been hearing about it. I've been researching about it. It's kind of a scary thing. And I'm glad we have our savior, the great RFK here, because Maha, he's gonna save America through Maha movement, and Joe Rogan as well, of course. And
I'm taking my ivermectin and amino acids to stop the plague.
I've been taking my vitamin C pills as well.
Yes. So RFK Jr., as I think just about everyone should know by now, is that he's the Secretary of the Health and Human Services. And he was barely approved in the Senate. What was like a 50-50 vote with the VP being the tie-breaking vote?
Yes, it was.
Because 4 Republicans decided to jump ship and vote with the Democrats.
Yeah.
So very, very close confirmation hearing, or confirmation vote. Barely didn't get it. That being said, what are the major takeaways of him being basically in his position?
Well, early in his position right now, what we're seeing is he's cut 3,500 jobs at the Food Drug Administration, 2,400 for the Disease Control Prevention, and 1,200 at the National Institute of Health. And then also there was 10,000 recent volunteer departures. And then so it will reduce it from the full-time people of HHS from 62,000 from 82,000.
So they're going to have a decrease in 20,000 employees in the HHS. And I saw something today on Ground News. I was like on my phone on Instagram. It's apparently the FDA is going to be softening up their policy on the work in person because of so many layoffs in the FDA that they're basically having to like pause certain programs, or because certain programs are moving so slowly now.
Yeah.
That they're basically making the work from home policy a lot more lax for the FDA because of it.
Yeah. And I mean, we'll see. And one thing that I thought was interesting, I didn't hear a lot about, was the Administration for Strategic Preparedness and Response has currently independent HHS agencies with 1,000 employees that will be moved into the CDC.
1 second.
I think you need the vaccine.
Yeah. I'm going to apologize in advance in this podcast. I might be sneezing and blowing my nose a few times throughout this episode. I don't think I'm sick. I just woke up and I'm just like, I don't have any symptoms of a cold or anything. I just have a really stuffy nose. And because of the stuffy nose, I am like compelled to sneeze.
I feel like they could have been more great timing on the sense of, after I just mentioned all these cuts, you're blowing your nose.
I know.
And, some other cuts that have happened from Doge, as you've heard, like with freezing funds and of things of that sort. NPR was reporting that in Pima County, Arizona, there was the federal government took away $1 million in grant money, where it was offering COVID vaccines and flu shots. And also, I believe in California, there was a cut to about the grant terminations would cause them an $840 million loss in federal fundings. This was used for virus monitoring, testing, childhood vaccines, and addressing health disparities. So it's a lot of cuts and a lot of reducing of just kind of the federal government's role in said, states.
Well, I mean, if you want to talk about that, I think you should look at the context of like Texas, for example, where Texas currently has a bit of like a measles issue, and people are criticizing the government, RFK, for the shrunken size of the preparedness of the state to adequately respond to the measles. And I think what's interesting about the measles issue there is his comments on the measles vaccine and such in response, which was, he basically came out saying he's pro the vaccine. He thinks it's one of the best prohibitors of the measles. What do you make of that in the context of who he is?
I think there's a lot of things with RFK while looking into him, RFK Jr., that is really confusing, because when you look at him, his beginnings as somebody that was talking about vaccines, he honestly doesn't seem that radical. Like he is, one of his first statements is like, People who advocate for safer vaccines, this was in 2017, should not be marginalized or denounced as anti-vaxxers. I am pro-vaccine. I had all 6 of my children vaccinated. I believe that vaccines have saved the lives of hundreds of millions of humans over the past century, and the broad vaccine coverage is critical to public health. But I want our vaccines to be as safe as possible. So that's one of his first statements, and you see that he is, like, I want vaccines to be safe. And this is also followed up on a episode of his well, not episode, but it's an organization a stream that he works for, Children's Health Defense, in June 2020.
Did he found it, or did he work for
I think he worked for it or was one of the founders. I really don't know, because when I was going through this website, it was kind of scary, because it's looks like I might get a virus.
He chaired it for a while. Yeah. And
so during that time on this like live stream, he says, like, I believe in a safe vaccine. Like, I want vaccines to be safe. If they showed me the proof, I will give it to my children. I would give it to my children. But then in July 2023, he just goes, there is no vaccines that is safe and effective. So
what does he mean by that? Because then he's like kind of whiplashing back and saying the MMR vaccine is the greatest thing.
Yeah, it's just
a bit hyperbole. But
but no, it's interesting because it's him going back and forth, and I was like, it's him going back to a position he's held before, and I think just during COVID, his message got extreme, and then he was like,
time to tone it back.
Yeah, and like, I mean, we could talk about some of his comments about COVID later, but it's just the RFK Jr. rise and downfall is pretty interesting to me.
Well, I don't know if it's like the rise and downfall, because I think he's pretty much rose, and he's he has a position as the Secretary of Health and Human Services.
Of seriousness, of like respect, like he had respect. I would believe maybe across the aisle as somebody when he was talking about like the environment, like he was a consideration for the Obama administration for the EPA.
Yeah,
and now he's a health secretary, and
right. It is a bit of a shame, like the vaccination talk and all this stuff, like him being put in the health secretary. Because personally, I think he would be a good pick to just head the FDA, for example, or just kind of oversee the FDA. Because I think a lot of his food policy, some of it's a little weird, but most of it like generally is pretty, I think, agreeable. There's a lot of chemicals that we have in our country that no other place in the world allows, and it's all just the big food lobby. And he's been since day one like a critic of it. It's a shame because I think a lot of his food policy is getting drowned out because of all the vaccine talk, which is obviously this vaccines are very important, and it's like very valid that it is, but it is a little bit sad to see.
Well, I don't know if he just doesn't know his audience, because
American people.
No, but I'm saying, like, I don't know if I think he thinks his audience is like majorly also into being anti-vax as well. And don't get me wrong, I think that's a good amount of it, but I think a lot of the people that like RFK Jr. he's this old guy that's very healthy, doing push-ups and all this is supposed to be like a symbol of health.
Even the brain worm.
With the brain worm, but he's also like
what used to be.
Yeah. The brain worm died, I don't know if it died from eating his brain, and I don't know. But like, he's like supposed to be like the symbol of like health for some, and like especially his food policies, like don't eat those oils, like, and that's where I feel like he just went off the deep end with talking about vaccines, and I don't think it was really part of his brand that was really achievable.
Yeah, I mean, the vaccine lore goes deep. Like, I forgot what it was. Like, what he was doing in Samoa in 2000 and hold on, let me make sure it's the right. It was like RFK. Samoa,
he has a lot of random things. Like, he left a dead bear in the New York City. This guy is like he's definitely a Kennedy. With the most random sort of acts that he's doing, but it's just yeah.
So hold on, I gotta sneeze again. Please, take the mic for a second. Oh man,
wow,
my bad, guys, for this.
Wow, Maha really needs to
Yep.
kick into effect here.
Sorry. No, okay, so no, actually, yeah, I need the cold vaccine. I don't know. Basically, basically, so the Samoa, I think, had a measles outbreak in like 2018, 2019. And allegedly,
Are you talking about?
when RFK went over to visit and basically met with like local people in Samoa and was like, yeah, vaccines are bad. Like, don't take the vaccine. And he's like been claimed to be attributed to like direct deaths as a result of
What?
it. Yeah, this wasn't like. This is just something that I remembered off the dome talk, like that. This being brought up, like no, like I would remember seeing this in, like the Instagram comments on like meme posts. It's like, don't ask what he was doing in the summer of 2019 in Samoa.
I thought you were going to talk about how you thought the Lyme disease
Oh,
was a
that's
military
another
bioweapon.
thing.
Like, I guess we have to now just go into COVID and really just talk about some of the more absurd things he said, because, like I said, the jump from 2017, 2020 to 2023 is very drastic. 2023 he becomes and says there's no vaccine that is safe and effective.
Yeah, I think it should be a case study on RFK's rhetoric during COVID. 'Cause
Yeah.
his rhetoric becomes, well, let's
I think
just say it.
well, no, I want to say this though before. I think why his rhetoric became more powerful to a lot more people was because of COVID,
Yeah,
and
without
was
a doubt.
because like people like Joe Rogan, for example. Whatever you believe, Joe Rogan, he started taking horse dewormer or ivermectin,
Yeah, I remember
horse
horse dewormer, dewormer,
sorry.
if that's a word.
Yeah, and like it supposedly it worked for him, right?
Supposedly.
Yeah, and then CNN was but painting him differently. Like he had the person on for CNN. He was like, well, in this video, you guys make me look like all yellow and like sick, and then this in the actual video, like I look normal. Like,
Oh yeah, they put like a filter.
I think there
over
was
it,
just
yeah.
like a lot of podcast movements like that, and like people then citing Joe Rogan, be like, look what the mainstream media does. Distrust from like the system of being like, well, is the vaccine safe? Because
Yeah.
I think for me, I don't know a lot of stuff about vaccines or MMRs or whatever, right?
We're not doctors.
Yeah. And like
Oh my god. Sorry.
like I've had multiple friends explain to me, like, because I'm like, how did we get the vaccine so quickly? Like, did it kind of concern me? Well,
Trump and Operation Warp Speed, baby.
but I was like, but it did kind of concern me because I was like, am I about to put something like in me like that's like bad? But I had a lot of friends that were like explaining to me that like, no, we have this thing like it can replicate a lot of different diseases, and you could like
Also, a lot of like I think technology were able to map out the COVID a lot quicker, more efficiently.
Yeah.
So we had a more proper, responsive like
Yeah.
creation to it.
like they explained it to it. I was like, oh, and then like for example, people talk about like how COVID came from Wuhan, and they're like, why were they messing around with diseases and making them more infectious? And like I was like asking that, I was like, why is that? My friends explained to me, it's like, well, we do that because, imagine if COVID was deadly, but imagine 10 years ago we made a deadly COVID and we found a way to make a cure for it or make a vaccine for it. We do these things so there's so many variants, and we try to fight them preemptively.
Right.
And so like for me, like having somebody like answer those questions were really helpful. But when 2020 in COVID, we really don't get those answers, and we get conflicting reports from the White House and the media about where COVID originates from, if it's from a lab, if it's from a bat, or from all these different
wet
things.
market,
Yeah,
yeah.
wet market. And so I think the disorganization of information and people not getting the questions answered, because it would just be like, well, some people think it's weaponized, and it's like, those people are absurd. Well, or it's like, well, yeah, it could have been weaponized, but we do this thing of like making diseases deadlier so we can have the vaccine for the future, or know how to respond to them. So I think this is kind of where COVID really opens up the doors for disinformation, disorganized information, and miscommunications.
Yeah, I think it fundamentally rattles a lot of rattles the establishment and like creates a lot of discontent with the establishment. And then because of that, people look to alternative sources, and it was field day for the podcast scene. It was field day for basically everything else.
Yeah.
So let's.
Yeah.
Speaking of, I don't even know where to begin with this.
Well, let's just first talk about RFK's video in 2023.
Yes.
And his first thing he says is, there is an argument that this is RFK Jr. saying this, just to clarify that again. He goes, there is an argument that COVID-19 is ethnically targeted. COVID-19 attacks certain races disproportionately. immune people are Ashkenazi Jews and Chinese. And it is COVID. I can't, like, it's just so much.
COVID-19 is targeted to attack Caucasians and black people.
Yeah.
The people who are most immune are Ashkenazi Jews and Chinese. Not only that. I like how, like, the way it's viewed. It's not that, like, it's because maybe, races are affected disproportionately because of socioeconomic reasons or societal reasons, or just where it's been spreading regionally. He uses the term ethnically targeted.
I know. It's not like it was made in a lab and it leaked. No, it was made in a damn lab. Then they targeted certain races. And then I was like, but my favorite part about this is he says, like, Chinese.
Yeah.
And I'm like, but didn't China, like, weld people into, like, their buildings because they're, like, trying to have a strict quarantine thing and do all these, like, crazy things? So I'm like, if it was, like, modified to not affect, I don't even know how you do that, like, certain races, like,
you know what's weird about COVID? I remember distinctly because my mother was, like, deathly afraid of the COVID for, like, a very long time. Like, she thought, like, if she got it or if my dad got it, like, it was just death, like, it's over. And I remember my mom showing me videos of, like, the hospitals in China, like phone footage. And it looked like back when, like, the high point of COVID, like, I'm talking, like, the zero lockdown or whatever it was, when Xi Jinping just, like, completely shut down cities completely. And, like, no one was allowed out and stuff like that. And this was, like, near the beginning when, like, America didn't really know what COVID was about yet because it hasn't really hit us hard yet. Like, it was starting to come around, but not quite. And I remember seeing the videos, and it literally felt like you were watching some scene in, like, World War Z in, like, some hospital where, like, it looked so dystopian.
Dude.
Like, you thought COVID was, like, the next Black Plague. It was really weird.
And there was, like, doctors, I believe, that were either silenced or disappeared or were killed in China, and it was crazy. I remember, like, seeing clips about that, and, like, I was like, okay, and, like,
this could be really serious.
I was a very surprised person. Like, I saw, like, things being like, oh, like, whatever, like, I think there's a doctor that has appeared and, like, reports coming out, but, like, I was going to, like, the movies still,
really,
and I think it was sometime around October for me, right? Is that when that kind of, like, kicked it? Like, it was during the beginning of lockdowns when lockdowns started rolling out. I would think it was October.
Yeah, I was going to say,
actually, March, April,
I distinctly remember my family, we went to Fort Lauderdale for some spring thing, and on the flight back, we were in the airport, and I distinctly remember seeing, like, on the news, like, first cases hitting the U.S. or something like that, or, like, serious quantities hitting the U.S.
Yeah. So that was, like, I remember the 2 weeks off, a lot of people remember that 2 weeks off thing, and something that's the go forward with this and talking about more of what's called RFK's post. He did apologize, by the way, for that. It was a mistake, but then he also, then what else? Then he also later would say, in a rally in 2022. So this is before the 2023 statement.
Well, hold on. Let's just go through the ex post. What he said was that he was not only mistaken, but just to clarify that he has never ever suggested that COVID-19 virus was targeted to spare Jews. I do not believe and never imply that the ethnic effect was deliberately engineered.
So still believes the Chinese are...
Yeah, the engineered part, just the ethnic effect wasn't deliberately engineered, but the rest of it,
Maybe.
Well, the House Republican investigation came up and said that it is a lab leak.
No, I think it came out and it was confirmed it was a lab leak.
I don't know. I still
Because I wouldn't be shocked because I mean people did talk about like it does look like it was a modified thing.
Yeah, I don't know. It's still like this conflicting thing because I hear the Republicans investigation came up with that. People are saying that it was biased, but then also like super tech bros going, nah, man, like the if you actually look at the mRNA sequence G47, it's natural. So I'm agnostic. I still have no idea.
I mean, I think Jon Stewart had a very funny comment about it, you know. He was like, well, we have a COVID-19 virus from the COVID lab from Wuhan. And he was like, you know, if there was a chocolately good breakout and it broke out in Hershey's, Pennsylvania, I don't think we would be like pointing fingers anywhere else. It'd be from, you know, Hershey's.
Yeah.
And so, I mean, I bet that could be conflicting still. But
it could be a plant by deep Lindt chocolate.
I think maybe RFK did it himself. RFK did this. See, everyone thinks RFK is dumb. No. He's a genius. He did this to get his secretary's spot 4 years later. And so in 2022, though, gosh.
Grand plan. Okay.
Yeah.
So, you know what? You could take this one, honestly.
In 2022, he did stay at a
anti-vaccine mandate protest.
Yeah, in Washington, D.C. Even in Hitler Germany, you could cross the Alps into Switzerland. You could hide in the attic like Anne Frank did. But
in America, you can't even hide in the
that's
attic.
what I was like. I was like sitting there. I was like, was that supposed to be a thing of freedom? Like you could hide. Like what?
Yeah, I'm not really sure what he was getting at there.
But yeah,
like we can get away from the mandate, but because the mandates are so global because of the globalists.
No, I think it's because the government's so big. They'll come in there like Ruby Ridge and Waco, Texas, and they will vaccinate you. Even though there's a lot of yesterday I was at a moot court tournament watching, and it was about vaccines and if the government can really enforce them or not. And there's actually so many protections for people not getting vaccinated or the government enforcing a vaccine
Correct
mandate.
me if I'm wrong, but like federal vaccine mandates like only really apply to federal employees, and what the CDC does is that they just lay out guidelines and recommendations, and it's up to the individual states to actually implement any
There's
mandates.
A lot of stuff like for example, the case that they were talking about, it's fake cases, real law.
Mm-hmm.
And the case was like this guy doesn't want to get the polio vaccine.
And this is moot court, you said, right?
Yeah.
Yeah.
And the Congress passes a bill to get enforce a polio vaccine on him. And he was like, you guys can't do that. Then they cite Commerce Clause, and it's a whole thing. And I really found the case being against enforcement compelling.
Question. When they cite Commerce Clause, like, if he gets polio, we can't do commerce. Therefore,
it's a whole low.
God, I hate that. I hate arguments on that. Everything is commerce because at the end of the day, it's going to affect our trade.
It was a conflicting thing between.
You have to get the brain chip because if you don't, you're going to be dumber, and if you're dumber, we'll have less trade.
Well, so
Commerce Clause.
I know you're really interested in the Commerce Clause. I wanted to touch on this really quickly because I thought it would be interesting. There's a case called Wickard versus Filburn.
Yeah.
And you know that one?
No.
Okay, so Wickard versus Filburn, it's 1942. People are growing wheat in Ohio by themselves. And there's a limitation on how much wheat you can grow.
Oh.
And he was like, I'm growing wheat for myself.
Yeah.
And
is this like related to like the FDR quotas? And he was like bypassing, and he was like,
yeah.
Well, your personal surplus can actually mess up.
Yeah, and they're talking about like, well, if everyone grew their own wheat, aggregate, this was the argument for vaccine mandates as well, because if it was an aggregate effect, therefore it caused the destabilization of said wheat farms, and I guess we'd have too much bread.
Yeah,
I don't know.
yeah. If everyone just grew their own wheat privately, then the entire wheat market would be messed up, and it'll completely undermine the wheat economy. Therefore, no growing personal wheat.
Yeah.
I think, and then the court ruled with the court ruled against the farmer, right?
Yeah.
Yeah.
We'll get to that another time. Maybe that could be our next time. We can talk about Commerce Clause maybe next time. But
Fucking Commerce Clause.
But talk about the anti-vax movement and going to RFK's career towards this time and moment. He then backpedaled from his 2022 comments and his 2023 comments.
Right.
And it was like, news reports have claimed, this is during his Senate hearing, that I'm anti-vax or anti-industry. I'm neither. I'm pro-safety.
Right.
And I kind of want to highlight this on like a, maybe I'm trying to think if this applies to more cabinet members overall.
Right.
But during the Senate hearings, I don't know if you saw this element or this theme. They're all like, well, no, we're not trying to be radical. We're just, these are things of safety and common sense.
Yeah.
Except by talking about
the common man's thought.
Yeah, like certain restrictions with women in the military and being like, well, it's for safety and security. RFK being like, this is for, safety and for the safety of the people. And I bet if I go through a bunch of other clips, you'll see the theme of, well, no, we're not doing anything crazy. It's just for the safety. And I bet that's common for a lot of things. But I guess it's really prevalent to this Trump administration because even during the campaign, we talked about how J.D. Vance was like, these are the same experts that shipped away your jobs.
Hmm.
You see this lot of this rhetoric, and they've been developing it since the election to be like moving away from experts, common sense, or if we're not using experts, we're going to look for safety. We're going to have our own research studies. We're not going to trust the mainstream on this.
Well, a lot of it is now, finding like the new research to like prove a lot of stuff. I think what it was like, RFK promised by September we'll know what causes autism. Have you heard that quote?
No.
Yeah, so
there's just so much, so much.
Yeah, so the RFK basically was like, we're putting all our best research into this. By September, we're gonna know what are the causes of autism and why 1 in 36 babies in America are now diagnosed with something on the autism spectrum. The response that a lot of doctors have is 1 in 36. Yeah, there partially are like some environmental factors that are probably increasing that number, but also just the range of what autism is has been expanded a lot more, and we know a lot more about autism than we used to.
And there's more testing.
Yeah.
Like I was watching this
kind of crazy though, 1 in 36.
Yeah. Well
strategically mean that in your grade there's like 4 kids probably with autism on the low.
See, I don't believe that.
You don't believe it? You think it's too high?
I think it's too high, or we're just like it's too broad. Like I think it's
if that's the case, like there's some form of autism that we're saying 1 in 36 kids have in America.
Well,
and then there's always the argument there's a bunch of kids who are not getting tested.
I know, and I just
diagnosed.
I don't know. Like we also have like because people use that statistic, right?
Yeah.
And then like it's like the problem is anti-vaxxers use that statistic, and I'm just like, so you're telling me if I had 1 out of 36, pretty much if I had 100 people in a room, there would be 2 autistic people. But the thing is,
but it's also a spectrum.
But yeah, it's a spectrum. So now like they're like gonna be like because when those anti-vaxxers look at it, like on the same video that I cite about the Health Defense Forum,
right,
they talk about like nonverbal autism.
Right.
They talk about like the cases that are very
obvious,
or very like prevalent, versus like things of like OCD, which might be considered, or like ACD, like not ACD, ADHD, like all these little like things that you would never be able to tell because we have expanded the spectrum. And like, so yeah, 1 out of 36, but like they view it as 1 out of 36 is like something that's nonverbal. Someone's like has a very
they both take the weird extremes of interpreting
that's
the data.
Why it's like,
well, I mean, there is a good question to be asked, which is, are we in a lot of ways overdiagnosing kids for profit motive and profit gain? So like, for example, there's a lot of people out there who are misdiagnosed for like ADHD or ADD.
A lot of boys.
Yes, a lot of boys are misdiagnosed, or there's a lot of kids who actually fake their diagnosis to get extra time on exams. Yeah. Like those are real things.
Yeah.
So because of it, our numbers are artificially inflated. But then also there's just, especially for boys, and this like really sucks. Just like, yeah, naturally, I think most young boys don't want to sit. I guess this is so like done and talked about, but there's a lot of young boys who just don't want to sit in a classroom seat all day and just listen to like a teacher talk. Like they can't, too much energy, and then they get punished for that.
And I feel like maybe rhetoric like this would be fine.
Yeah.
But then like RFK uses rhetoric like this, and he's like, well, yeah, they're mixed diagnosing, or they're correctly diagnosing, but it's because of like, and I would say maybe the food products have some elements. Like people say like Red 40, and like people talk about that in Britain. But it's just the vaccine thing actually just makes me so angry because I was watching this Jubilee video, and like it was 20 people go against Dr. Mike, and they're all talking about these like statistics and numbers, and I was like sitting there, I was like, okay, so you guys believe it's 1 in 100? I'm like, if we multiplied that and did all this
what's
math,
like 1 in 100?
like like every kid that gets vaccinated has autism.
Oh yeah.
It's like, and it's just like, what? And then the people that were talking about it, it was so funny. One person was like,
well, wait, if the diagnosis rates of autism is 1 in 36, and if we assume that like all these kids are getting like vaccinated, 1 in 36 kids who get vaccinated should also have autism.
That's
no?
what I'm saying. It's like, if we just mapped it out, you'd be like, okay, do you really think like how many children are born per day? And in doing all that, you're like, you really think there's that many people?
Yeah.
And like, I wanted to know what they define as like the spectrum, because like, come on. And like for example, one of the persons was like, oh, we were on a hike and this older preacher guy that got the COVID vaccine just fell over and died and had a heart attack. Me and my friend, these two younger women, were like, oh, like we didn't get the heart attack, and we didn't get the vaccine because, you know, we're healthier than him. And I was like, yeah, you're on a hike with an older guy and you're both younger. Or like, it was just like all these, it's a great video to watch because you're sitting there like, what the hell is going on?
Yeah. Well, a lot of it is like one confirmation bias, but also but also a lot of it is like just it's a definition of like correlation, not causation.
It is so much of that.
Yeah.
Like what's it called? One of the women was like, oh, I had a kid and I gave the vaccine. Another kid, I did give the vaccine, and the kid I gave the vaccine to, he turned out to be autistic. And the doctor's like, well, yeah, but like at the same time, I've had a person that a baby that was born, right? And the kid turned out to be autistic. And if we were just about to give the vaccine and something happened to the kid and we prevented it, giving the vaccine to them, but if I gave the vaccine to that kid and then that thing happened, it would have been a correlation event. And like part of maybe statistics or something like that. And so it's just like, that's what I mean. It's like all this questioning of it is not like, I wouldn't say like maybe there's no world where you can question it or have no valid reason to be anti-vaccine for yourself. But en masse, I think a lot of it is just like ridiculous when they use statistics.
No, 100%. And you know, it's because there is like a very, very like thin essence of truth in the vaccine danger argument, because vaccines are like 99.9999% safe.
Yeah.
But every now and then, and like this is a matter of like statistical like kind of fact in a sense. It's like every now and then either a vaccine gets botched or a child's immune system out of birth was weaker than we anticipated, and they have a negative reaction to the vaccine. But this is like extraordinarily rare. And then out of reaction to the vaccine, some babies get like messed up because of it. But like I said, like this is like true in the sense that it unfortunately happens. You know, obviously to like have that happen to your child is traumatizing. No. But the numbers of that happening are so statistically low that it's really not, I don't think, a concern or a valid thing to point to.
And like,
but there's an essence of truth behind it.
And one time, the one thing I've heard that was like semi-valid, and it was only semi-valid for this one person, was like they played baseball. They're not professionally, but they're going to college to play baseball. And they were like, well, I read one study about one of the COVID vaccines that could cause heart palpitations. And I'm a very active person. I don't want that to affect my career. Like, I was like, okay, sure, makes sense for you, whatever. But like most of the time, I'm just like, dude, what is going on? Like like I don't know, like being from Arizona, like we were very like open air, very like whatever, be outside. A lot of people I know did get the vaccines though, like quickly, right away. Like there was only a few like holdouts,
Yeah.
and like
I,
some people were like, "This is crazy. I can't travel anywhere because I didn't get the vaccine." And I'm like, okay, like it's a choice essentially in some ways, but yeah.
yeah, I mean, like all these airline companies or private companies, they have the right to deny you access on their own standards.
Well, yeah, and these were like people with like that was like very first world problems. Like I
Yeah.
can't travel to another state, and I need to have a vaccine. You know what was crazy to me was people buying
Fake vaccine cards.
Yeah, like
Okay, I actually know someone who did that.
I know people that did that.
Yeah.
I know people that like I was like it's crazy to me. I was offered one. I was like, no, I got vaccinated. I'm good.
Well, to me, it was a matter of, like, I was a little weirded out because of how fast we got the vaccine out. I was like a little like,
Yeah.
like I waited a little bit before,
I waited like a
after it
month.
came out. Yeah, like I wasn't like first in line. I can't wait to get my vaccine. But thank you, Dr. Fauci. But I waited like probably like a few months, and I was like, all right, I'll get it. I mostly did it because I did track and field in high school, and if I didn't get vaccinated, I couldn't attend like track events. I was like, yeah, no, I'm not. I'd rather do track and field.
Also, I have I have older family members and all that, and like for me, we talked about this. We both agreed that it was weird how quickly it came out. But then when you look into like the infrastructure of how we've developed vaccine infrastructure, it's like, oh, okay, it makes sense that it came out that quickly.
But also, is there not like the contradiction? I think for a lot of like RFK Mahas, where it's like praise Trump, praise the MAGA movement, and then Trump like under Warp is like, this is the greatest thing. We came out so fast. The China virus didn't even see it coming. And like you're not gonna trust Trump with his vaccine that he touts about like all the time.
I know, that's what I'm like. You guys are like, oh, Trump's the greatest. I can't believe he picked RFK, and I'm like, you guys are voting for Trump, the same guy. The vaccine that you're so against was developed under his administration,
right?
And I wanted to I think touch on this a little bit as well. Is it shows RFK's power this election.
You think he was like?
I think he was the
essential pickup.
I think he was the Ross Perot of this election.
Really?
Because I mean, at one point he had 10%.
True.
He was trending at 8 to 10%.
But was it like 10%? But like he had a pretty even split for both parties, like where he was taking votes from.
Yeah, but you could, let's say that 10%, let's say 5-5. If you even can pick up 2% from the Democrats or 1%, that's a helping thing in tight margin states. And if you're a Maha follower or RFK follower, I think you're really you're following him because you're like, I like certain things. Because his like policies were like, I remember watching his announcement speech. I thought it was great. It was like very like, we're not going to be doing this social, what's it called? Socialization of companies. We're not going to be keep supporting them. Social welfare for companies, corporate companies.
Socialized losses, privatized gains.
Yeah, and like all these things. And he was very coming out against that. It sounded very from like the left until he started talking about vaccines. And I think if you're someone that like likes Kennedy, a lot of his policies can be done under a different president in a cabinet spot.
Yeah, that's true.
So it's like, okay, I'm Kennedy. Let's say I really believe in this cause. I'm not doing this for political gain.
Right.
I get 10% of the votes. I start throwing out polling information that could say I could win certain swing states
and try to get myself a point.
And he offered. He talked to Harris. And he talked to Trump. Or Harris didn't. I don't think Harris took the meeting with him. Trump took the meeting.
Another blunder.
Yeah, and and I think he was the Ross Perot of this election.
Yeah, well, I mean, I think that's an interesting view of it. I don't know too much about it. I know that he was an interesting kind of dark horse candidate that could definitely have swayed in certain states. Let's rally back, or kind of circle back to the public health impacts. We talked about measles in Texas. We talked about the budget cuts. We talked about how the FDA is basically now loosening up employment in order to maintain things. Oh, are we?
Yeah.
I only have 39 on mine. Really? Oh, okay. Yeah. Okay. Okay. Cool. That being said, what do you think of like the impacts of like basically the politicalization of health, politicalization of medicine? I mean, we haven't even talked. There's so much we're not even touching on. Like we could talk about the international effects, like impacts of us. Like,
let me say this: I think one of my professors that used to work as a deputy in the Department of Health and Human Services put it really well. And it was first off, if we're doing all these cuts, they should have had a meeting. He worked on an administration where they had a few cuts, and he was like, "Hey." During the meeting, they're like, "Wait, are we going to cut this certain program?" No. Keep that program running. And he was like, so it was a very disorganized thing. Then second, he was like, "Oh, I don't know what we're going to do about flus." And I'm like, "What do you mean?" And we get this natural data from the divide of the equator from the southern hemisphere because they have the flu before us. We get like the flu variants from there. Then we start developing vaccines here. For
the
ourselves.
World Health.
Yeah, the World Health, multiple health institution, because we all do
work
that.
Together. Yeah,
and then we use those vaccines for ourselves and flu shots. So we benefit from that. And he was just like, also like a lot of this health information. I forgot what vitamin it was. I don't know how true this was because he was going on a rant. But he was saying people were fighting off the measles disease or trying to prevent it by taking a certain amount of or certain vitamin. I forgot which one. Like if it was a D, C, A, whatever.
Yeah.
But he was like, there's some cases of overdoses
on vitamin.
Yes, because it charged their liver or something like that. Like I forgot exactly what it was, but it hurt their liver so badly. Yes,
vitamin
A, and then in Texas, if you look it up, there was like 1 to 2 cases. He said there was like 30. When I looked it up, let's see. But like, this is something that's like crucial to me. Is I think we need somebody.
We don't need to export the measles vaccine into Texas. Just send them a shit ton of vitamin A.
I think this is where this rhetoric becomes dangerous.
Yeah.
Because like for me, like, yeah, I find sometimes like when I take like flu medicine not to work. When I take vitamin C, I feel a lot better the next day. That doesn't mean I'm gonna take like 4,000 milligrams of vitamin C. But like there has been people that are, including let's see.
I will say I do think that this is the biggest presidential experiment in history. Well, we're definitely going to see if a lot of the theory pans out or not.
Well, yeah, and I'm just like...
oh, brother.
And maybe nobody did die in Texas from vitamin A. I don't know. Because when I looked it up, it was it didn't feel like it was the first headline because everyone's like not wanting to talk about how people were dying. Okay, so yeah, there was some people... there's been several patients that have found liver.
West Texas children have been treated for vitamin A toxicity as medical disinformation spreads alongside measles outbreak from the UNMC, University of Nebraska Medicine Center.
Yeah, and
medical center.
I think that just kind of shows like this health sphere is disgusting to me. Like for example, there's this guy that was like on TikTok that's like, "What happens if your arm got cut off?" And he was like, "What I would do is pour honey, grab a raw steak." Attached to my arm, and I would not even freak out. And I was like, in my arm, and it was like, this is why you trust the science. I'm like, do you hear yourself?
Yeah, but what percent of that is just rage bait slop?
I don't know, but it is causing me the rage bait right now, man. Because a lot of this stuff, it just logically does not make sense. And like for me, like,
well, listen, this is what you do. Don't trust the science. When you get rage baited and angry, what you should do is you should go out get a honey badger. No, get a honey badger. Take their piss, drink their piss, and mix it in with a rhinoceros horn. And you're going to get healthy. Don't trust the science. Trust the ancient secrets.
And then go to the beehive and get stung by the bees. And,
right. Yeah. It's actually really good for you.
I heard.
I don't know. I think one of the worst things ever is that oh man, I don't know if it's liberating or bad and terrible. There's a bunch of people with no credentials, with no real intellectual ability, who run podcasts And they think they could just talk and talk and talk, and they really contribute nothing to the discourse. In fact, a lot of times they're just actively negative to the discourse and just spread misinformation. And very few podcasts out there, that I really like the Huberman Labs podcast. It's a great
I've
podcast.
heard of it, yeah.
Great podcast. Or the Lex Friedman podcast, great podcast. They do a lot to contribute. And there's other ones. Like the ones you see on YouTube Shorts of just like the I get 4 days out of a single day, I'm winning kind of guy. And you're just like, no, that shouldn't be allowed.
Haktua?
Yeah.
I think I'm gonna give you a list of podcasts to listen to, and I think I need to get your stamp of approval or disapproval.
I think we have to have a Bureau of Podcast allowance and just get rid of 99% Lemonade Stand HQ.
I love Lemonade Stand. It's one of my favorites, actually. I love that one.
99% of podcasts should be wiped off the face of this earth.
Except
Platoon is different.
Platoon, Who Dem,
We are
Lemonade Stand, and the Ezra Klein Show from our producer.
Yes. What's that one podcast with like
The Daily Wire.
No. Yes, The Daily Wire, which is definitely not imploding right now and having internal disagreements.
You mean Steven Crowder's?
Louder with Crowder, boys.
Yeah.
Brother. I love it. You got to respect a man who mentally abuses his wife. That's great. Anyways.
His pregnant wife.
Yeah, that was really, really conservative values of him. Okay, well, I think that's all there is to talk about today. I mean, there's a lot we could have talked about. This change of the CDC has wide-ranging implications, both domestically, which we focused on, but also internationally with AIDS control in Africa and HIV control in Africa and stuff like that. But with that being said, Trex, thanks for coming on.
Thank you.
And thank you for listening. This episode was brought to you by our producer, Miles Moorfield. This episode was also brought to you by the Ox Institute. For more information to keep up with them, follow them at oxinstitute.org. Thank you.